Dizziness Myths from dizzinessdoctor.com. Thank you. Thank you for your interest in dizzinessdoctor.com. If you are a person suffering from symptoms such as dizziness, imbalance, unsteadiness, disequilibrium, vertigo, etc., then our goal is for you to bring those symptoms under control. If you are a healthcare provider trying to help your patients manage those kinds of symptoms more effectively, then our goal is for you to understand better how to diagnose and treat the underlying disorder. Disclaimer: this material is intended for educational purposes only and does not substitute evaluation by a qualified medical professional. Accessing this material is subject to the terms and conditions detailed at dizzinessdoctor.com. Purpose of this presentation: the problem. I've heard lots of different things about my dizziness, and I am not sure what to believe. The solution: we review some of the most common myths about dizziness. Introduction: if you are experiencing dizziness, you will find that many people will be happy to share their stories and give advice. It is natural to seek advice about a problem from family and friends. Often it is helpful. Sometimes it is not. Some stories that we hear from our patients week in and week out reflect common misconceptions either about a particular disease or how to treat that disease. We review here some of the most frequently encountered misconceptions. Myth number 1. They said I have vertigo. This is not exactly a myth, but the statement is misleading. The term vertigo does not refer to a disease or diagnosis. Rather, it is a symptom that can be caused by many different diseases. We will illustrate this with an analogy by taking the example of tummy ache, because most people have had a tummy ache and can relate to this. Tummy ache is not a disease. It is a symptom that can be caused by a huge range of diseases, ranging from gas to appendicitis, to a bowel obstruction, to diverticulitis, to gallstones, to pancreatic cancer, and many others. While each of these disorders can indeed present with a tummy ache, they are very different diseases with different ways of being tested and treated, and with very different prognoses. The term vertigo, unfortunately, is similar in that there is an enormous range of diseases that can cause this symptom. So when a person reports, "They said I had vertigo," that does not go very far in clarifying the underlying disease, nor does it lead you to a specific treatment path likely to be of any help. Myth number 2. They said I have VOR. This is not exactly a myth, but it is misleading. The abbreviation VOR stands for vestibulo-ocular reflex, a normal reflex that moves the eyes in response to head movements so that the eyes can stay on target. Telling a patient that you have VOR is simply saying that they have a normal eye movement reflex. Perhaps the healthcare providers who tell patients that they, quote, have VOR, close quote, mean that there is a problem with your vestibulo-ocular reflex. This is more correct insofar as it acknowledges some sort of deficiency with the VOR, but it is nearly useless because it does not clarify what that deficiency is. Myth number 3. You can use the Epley maneuver on both sides. The Epley maneuver is a specific vestibular physical therapy maneuver that is used to treat benign paroxysmal positional vertigo, the most common cause of dizziness, involving a part of the inner ear called the posterior canal, the most commonly affected part. The tricky thing about this is that when a person is diagnosed with benign paroxysmal positional vertigo, abbreviated BPPV, it may not always be clear which ear and which canal is involved. Patients seeking quick relief from their dizziness, and well-intentioned healthcare providers trying to help them, may attempt doing the Epley maneuver on both sides to, quote, cover all the bases, close quote. Usually, this approach will not work. The reason is that because the geometry of one inner ear is the mirror image of the opposite ear, performing the Epley maneuver on one side will undo whatever benefit might have been obtained when it was performed on the other side. Therefore, performing the Epley maneuver on both sides will not usually achieve symptom relief. Myth number 4. Steroids treat vestibular neuritis. Vestibular neuritis is a common cause of dizziness and is believed to result from inflammation of the balance-related nerve between the ear and the brain. Because inflammation appears to be involved, some of the earliest research about treatments attempted using various steroids. However, many subsequent studies have shown that steroids appear to be no better than placebo, a sugar pill, in the treatment of vestibular neuritis. Myth number 5. Migraines have to include headache. Migraine is a common problem and has been studied extensively, yet remains somewhat poorly understood. Migraine can cause non-pain symptoms such as dizziness, sometimes called vestibular migraine, nausea, vomiting, visual distortions, and many others. In some patients, their migraine may cause those non-pain symptoms even when no headache is present. In other words, actual head pain need not be present when a person is experiencing the non-pain parts of migraine. Myth number 6. There is no test for Meniere's disease. Meniere's disease is a progressive, degenerative inner ear disorder that causes episodes of vertigo, usually lasting hours, accompanied by one-sided ear symptoms such as fullness, hearing loss, and tinnitus. Tinnitus is extra sounds that should not be there. Many patients are given the impression that there is no test for Meniere's disease, but this is incorrect. While Meniere's disease is not always easy to diagnose, there are some tests that support the diagnosis, starting with a simple hearing test. Several other tests, usually only available in specialized centers, can also help confirm the diagnosis. Thank you. Thank you for viewing, reading, or listening to this material and for your interest in dizzinessdoctor.com. We welcome your feedback and support. The highest compliment you can give us is to refer our educational materials to others who could benefit from them.